first going to look at cranial nerve 1, the olfactory nerve. The clinician is going to have the client smell essential oils and say what she smells. Damage to this cranial nerve can cause loss of smell.
Okay, Janine, can you close your eyes for me? And plug your right nostril. And can you tell me what you smell?
Peppermint.
Okay. All right, keep your eyes closed. Now plug your left nostril. And tell me what you smell.
I don't smell anything.
Okay, thank you.
Next, we're going to look at the second cranial nerve, the optic nerve. Damage to this nerve can cause anoxia. We're going to test this by having the patient read letters from a chart.
Okay, Janine, can you see this chart?
Yes.
Can you tell me the letters on the first row?
E.
Second row?
F P.
Okay, now read the letters going down.
T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C.
Okay.
Next, we're going to test the patient's visual field.
Okay, I'm gonna hold out my hands and you point to the side where my fingers are wiggling, okay?
Both sides.
Good, okay, so now I'm gonna hold out fingers and you tell me the numbers of fingers on each side, okay?
1, 2,
Okay,
2, 3,
okay,
3, 1.
good.
We will now look at cranial nerve 3, the oculomotor nerve. The clinician will look at the client for eye deviation, eyelid drooping, pupil dilation, pupillary light reflex, and test eye movements. Lesion to this cranial nerve can cause eye deviation inferiorly and laterally, eyelid drooping, pupil dilates, and pupillary light reflex lost.
Okay, go ahead and look straight at me. Okay, I'm gonna shine this light in your eye, one on one side, one on the other. Okay, great. Now I want you to look right at me, don't move your head, and follow my fingers with your eyes, okay? Good.
Now we'll assess the fourth cranial nerve, the trochlear nerve. We'll assess this by having the patient look straight ahead at the wall. Next, the patient will be asked to look up and down and then side to side to assess if there is a lesion causing superior and lateral deviations of the eyes.
Okay, look straight ahead for me, and look all the way up without moving your head. Okay, look all the way down, look all the way to the left, and to the right. Great.
Next, we are going to assess the fifth cranial nerve, or the trigeminal nerve. Here we are going to look at 3 different nerves that make up the fifth cranial nerve. We will start by testing the ophthalmic nerve, then the maxillary nerve, and then the mandibular nerve. Lesions to this nerve can cause ipsilateral loss of tactile and pain. In addition, the mandibular nerve lesion can cause jaw deviation ipsilaterally.
Okay. Can you feel this?
Yes.
Okay. Can you feel this?
Yes.
Do they feel the same on both sides? Okay. Can you feel this?
Yes.
This?
Yes.
And does it feel the same? Okay. Can you feel this?
Yes.
This?
Yes.
And do they feel the same?
Yes.
Okay. And then open your jaw wide for me, please. Okay. Good.
Now we'll assess the sixth cranial nerve, the abducens. Damage to this nerve will cause medial or lateral deviations of the eyes. The clinician will ask the patient to look straight ahead.
Okay. Can you look straight ahead for me? Okay. Perfect.
Now we are going to look at the 7th cranial nerve, or the facial nerve. First, we are going to have the patient go through some different facial expressions. In addition, we will test the taste from the anterior 2/3 of the tongue. Lesions to the facial nerve can cause facial expression paralyzed ipsilaterally, ipsilateral loss of taste from the anterior 2/3 of tongue, and also cause acute hearing.
Okay. Smile wide for me. Show me all your teeth. Good. Now frown. Okay. Puff out your cheeks. Okay. And squeeze your eyes really tight. Okay. Good. All right. So now, can I have you open your mouth for me, please? Okay. And tell me what that tastes like.
Bitter lemon.
Okay. Great.
Next, we'll assess the eighth cranial nerve, the vestibulocochlear nerve. Damage to this nerve can cause loss of equilibrium. We'll assess this by asking the patient to identify if she can hear a sound when the clinician rubs her fingers together just outside of the auditory canal of each ear. A hearing test can also be used to determine if the patient has ipsilateral deafness. We will also check the patient's balance by having her walk in a straight line, heel toe, heel toe.
Okay. Can you hear this?
Yes.
Okay. for me, please?
Sure.
And then can you walk a straight line, going heel to toe,
Sure.
and then come back.
Okay. Okay, and then come back?
Yes.
Okay.
Okay, great. Continue.
Now we will look at the ninth cranial nerve, glossopharyngeal. We will test this by checking the client's taste from the posterior 1/3 of tongue and also check her gag reflex and palate elevation. A lesion to this nerve can cause ipsilateral loss of taste from the posterior 1/3 of the tongue and a loss of the gag reflex.
Okay, open up wide for me. Okay, and tell me what you taste.
Salty.
Okay. And open your mouth and say ah.
Okay.
Okay, now I'm gonna test your gag reflex, okay? Okay, great.
Next, we will assess the 10th cranial nerve, the vagus nerve. Lesions to this cranial nerve can cause the uvula to deviate contralaterally, a loss of the gag reflex, and a weaker hoarse voice. Since we've already tested the gag reflex while assessing the glossopharyngeal nerve, we'll record those results. First, we'll look inside the patient's mouth to see if there's any deviations to the uvula with a flashlight. We'll also ask the patient to say ah. Next, we'll ask the patient to tell us about her day. We'll ask the client to say a few sentences to assess any hoarseness or weakness in her voice. We'll also ask the patient if she's had any concerns with her voice since we don't have a baseline of her typical voice.
Okay, can you open your mouth and say ah for me,
Mhm.
please? Okay, and can you tell me a sentence about how your day's been today?
It's been pretty busy. We went grocery shopping this morning, and then later we took the kids to the zoo.
Awesome. Okay, have you had any concerns about your voice lately? Has it changed at all?
No, not at all.
Okay, great.
Next, we will examine the 11th cranial nerve, the accessory nerve. We will first test this by having the client shrug her left shoulder, then her right, then both of them together. Next, we will have our patient turn her head to the left and then to the right. A lesion to this cranial nerve can cause difficulty shrugging the ipsilateral shoulder and difficulty turning the head in a contralateral direction.
Okay, can you shrug your left shoulder for me?
Mhm.
Okay, now your right. And shrug both of them together. Okay, now turn your head all the way to the left and all the way to the right. Did you have any pain or discomfort during that?
No, not at all.
Okay, great.
The last and 12th cranial nerve we'll assess is the hypoglossal nerve. Lesions to this cranial nerve can cause tongue deviation ipsilaterally when protruded and slurred speech. To examine this cranial nerve, we'll have our patient stick out her tongue. Here we'll look for any deviations. Then we'll ask her how her weekend was. We want to re-examine her speech to see if she's slurring her words.
Can you stick your tongue out for me?
Mhm.
Perfect. And give me a sentence about how your weekend was.
My weekend was great. Very relaxing.
Okay, great.
We've now completed our assessment of the 12 cranial nerves.